This original WSRE presentation is made possible by viewers like you. Thank you.
The economic impact of COVID-19 on our regional economy on this edition of inStudio. Just as the memories of the Great Recession were beginning to fade, our nation was hit with COVID-19, a medical crisis that quickly expanded into an economic problem. On this edition of inStudio, we'll discuss the effects of the coronavirus on the regional economy. How bad is the damage? How long will it last? And what does the road to recovery look like? We're joined by economist and economic advisor to Triumph Gulf Coast, Dr. Rick Harper. Pensacola Chamber of Commerce President and CEO, Todd Thompson, and the CEO of CareerSource Escarosa, Sheryl Rehberg. Thank you all so very much for joining us. A little bit different than our typical environment inside the luxurious studios of WSRE television, but nonetheless, we are making do, and I think everybody in the broadcasting world is sort of getting used to this new format via Zoom. So thank you all for being with us. Dr. Harper, let me begin with you. You've been teaching economics for a long time. You've been a researcher. You've done all sorts of things. Very distinguished career. Would you ever have imagined that the economy would de-accelerate so quickly?
It was not something that was ever anticipated in any of the economics texts that I read. We essentially, as a result of the medical crisis, we put the economy right in the deep freeze, and it's been there ever since. I hate to use the word unprecedented because it's gotten a lot of work these last few weeks, but it truly is a unique situation that we just didn't anticipate in the economics literature.
What do you think the textbooks, how will they tell the story in the future?
I think the textbooks will look at the policy responses to COVID-19, and they'll ask, could policymakers have done more to get the economy back on track, to ease the human suffering and toll of the virus? I think looking at our policymaking environment, we've got a couple of big levers we can pull, and this has to be done at the federal level, because states, all except Vermont, for some reason, have the constitutional requirement to balance their budget every year, except for some debt service payments on certain things. And so states can't go heavily into debt to fund necessary things like unemployment benefits for the laid off leisure and hospitality workers who are so prevalent in Florida and in Pensacola. That's got to be done at the federal level. And so the Congress and from the Congress, the Treasury has taken unprecedented steps to get money out to people to spend it with the promise to pay it back sometime in the future. And of course, the Federal Reserve, the guardian of our currency, our monetary policy, the keeper of the vault, has taken unprecedented steps as well. And they're supporting loans that years ago you never would have seen them do that. Both the Treasury and the Fed got their powers during the Great Recession, now 12 years ago. And so we're lucky to have those powers available and people that are working there that understand how to respond to a serious economic crisis.
Would you say Fed Chair Powell did a pretty good job all in all thus far?
In my view, Chair Powell and the Federal Reserve have done an exemplary job. They're there to backstop the economy, to make sure that financial markets don't freeze up as they did, during the Great Depression. And ever since we've had a modern Fed, the Fed has been there saying, we will provide liquidity to make sure that banks keep their doors open, that they keep lending to their customers. And so that's what the Fed's done. So yes, he's done an exemplary job thus far. Now, the Fed has put us on the roller coaster because to do that lending, to get the money out there into the banking system, what they have to do is inject new reserves into the banking system. And so currently, the level of monetary base, the level of bank reserves that are out there sloshing around in the banking sector is about 7 times, almost 7 times the level that the Fed thinks is necessary to support transactions in a low inflation economy. So they've put us on the roller coaster. Sometime they're going to have to drain that money out of there.
What would be your best guess as far as inflation is concerned? That's obviously when you put that kind of money into the system, that's something that concerns everyone. However, if we look back to the Great Recession in 07, 08, 09, or I guess 08, 09, many economists and many folks were calling for an inflationary environment coming out of that. We didn't see it. And in fact, economists probably spent more time worrying about deflation than they did inflation in recent years.
And we are absolutely back in a situation where we're worried about deflation, the price level going down. And that's particularly risky in a modern economy, because if people come to expect that refrigerator or that car or that house is going to be cheaper next year than it is this year, then they'll wait to next year to buy it. And that means that then that sort of consumer behavior, and the consumer's 70 cents of every dollar of gross domestic product in the US. And if the consumer stops spending because they expect prices to be lower next year, which is the very definition of deflation, then that puts us in a downward spiral, because when consumers stop spending on that new fridge, on that kitchen addition, on that new car, that means that the people who are supplying the fridge, the business that was going to build the kitchen addition, and the company that was going to construct the new car or truck, they don't have the sales they need to keep going. And so the Fed is rightfully much more worried about deflation right now. Tremendous downward price pressure. We saw, negative $37 a barrel a few weeks ago on West Texas Intermediate. That's a situation that is ripe for deflation. And so the Fed is doing everything within its power to ensure that we get a little bit of inflation, so that people expect, I might as well go out and buy that refrigerator right now because it's just going to cost 5% more next year.
Hey, since you brought it up, let's delve into it just a little bit and talk a little bit about what happened with oil prices actually going negative for a very short period of time. Now, some of that had to do with the mechanics of the way the futures markets work and settlement issues and lack of storage. But nonetheless, rather intriguing that the price of crude oil went negative for a very short period of time.
It made me wish I had an empty swimming pool in Cushing, Oklahoma at the hub there where the oil actually gets delivered. You know, some of those traders were absolutely petrified that they were going to have to take physical delivery of those thousands of 42-gallon barrels of oil that they had contracted. And so they were willing to pay anybody, take it off my hands so I don't have to keep it in the garage. So prices did go negative. I think there's since been some adjustment on the production side to slow down the rate of production, capping wells. We saw Norway cut back production, for example. So it was a real shock, something that kind of blew everybody's mind looking at the markets.
Yeah, last thing you want is a tanker car full of crude oil in your front yard, right?
Exactly.
Neighbors don't like that. Sheryl, tell me a little bit about your organization, CareerSource Escarosa. What do you guys do?
We help connect businesses to employees and help train employees to get into a career or advance in a career. That's in a nutshell what we do. We are a nonprofit. We are contracted with federal funds. We're one of 24 local workforce development areas in the state of Florida. And our organization here serves Santa Rosa County and Escambia County. And so there's a wide variety of things we do, but our primary purpose is for people to get jobs. And we also provide access to the unemployment system. It's called Connect, and everybody has heard in the news about Connect by this time in this crisis.
What are you seeing as far as that is concerned? What are your constituents telling you about the challenges of trying to get unemployment?
They can't get into the system. If they get in, sometimes they can't complete the process they need to complete. Over the last couple of months, the system has improved. The governor has made some good moves to try to improve that system. It was just overwhelmed with activity, and there's been a lot of shoring up the technology resources, and so it's getting better. But we are still getting many calls from individuals who have claims pending for up to 2 months. And we're trying to monitor the initial claims by week. To this point, there have been about 18,000 initial claims for unemployment compensation in Santa Rosa and Escambia County combined. Over 12,000 of those are in Escambia County. And the different levels of unemployment compensation, there's multiple applications that need to be done. So it's confusing at this time because of the pandemic unemployment assistance on top of the state unemployment assistance. So it's a complex system. It's confusing. And what we're hearing from people is just the pain of job loss. Loss of health care benefits in many cases, many people who didn't have health care benefits with their jobs. So they've got multiple issues within the family that they're trying to deal with. And this complex system is just overwhelming. It's hard to describe how painful it is sometimes. We are beginning to see an increase in payments, though, to unemployment compensation, both the federal resource and the state resource. There's been a significant effort to specifically address the entrepreneurs who lost their business. So they lost everything. And there's been a lot of focus on that with small businesses. And I know Todd has dealt with that quite a bit too. But that's what we're seeing. Our phone calls into our career centers just automatically, instantly became hundreds of calls a day. And that varies. Sometimes, some days the claims get processed more than others. There are times when the system has to be shut down to claims, to dealing with claims, so that they can make payments. So in Tallahassee at the state level, it's been a real struggle, but I believe the system is improving, and I believe that everybody who is eligible for compensation will eventually get it.
Todd, what are the small business men and women telling you?
So we've done 3 surveys now at the Chamber since this all began. And, while these are not scientific surveys, these are surveys we've sent beyond just our membership. We've tried to get out to the business community at large. And the good thing is about 75% of businesses that responded have said that they'll be able to get up and running and back to full speed within about 6 months. We've asked questions like, how many people have you had to lay off or furlough? Have you changed your hours as a result of this? And from the data that we've received from these surveys, it seems like a lot of businesses have either cut back hours or they've gotten creative with their employees. So they may not work full time, but they keep them on the payroll. As you know, the Federal CARES Act had the payroll protection program. I've talked to some of the banks in town who participated in that, and they've had success getting those loans through and getting those to businesses. So I think that's helped a lot to keep employees on payrolls and try to get through this. Fortunately, we've got, tourism is going to start picking up with the vacation rentals being approved this week. Hopefully we have a nice big weekend here, Memorial Day weekend, to get things kicked off for the summer. We have another weekend in May, so that's good. And just hopefully we can get the momentum going, because obviously as you get more hotels, more people coming to town, more people going to restaurants, more people shopping. It's that trickle effect that'll help bring us back.
We are talking about COVID-19, the coronavirus, and how it is affecting the regional economy. Sheryl Rehberg with CareerSource Escarosa is joining us, along with Dr. Rick Harper, an economist, and also Todd Thompson with the Greater Pensacola Area Chamber of Commerce. We will continue our conversation in just a couple of moments. You're watching inStudio via Zoom on WSRE television, PBS for the Gulf Coast. Coming right back. Welcome back to inStudio on WSRE television, PBS for the Gulf Coast. We are talking about the coronavirus, or COVID-19, and how it is affecting the regional economy. Sheryl, you mentioned there was a lot of pain out there. You're seeing the personal effects of this. I mean, we oftentimes see in television and newspapers and whatnot, and just talk about it maybe from a 10,000-foot macro view. But you're seeing the actual pain of the people that have lost their jobs and lost them rather quickly. What kind of feedback are you getting from folks?
I'll give you one example. I have received calls directly to my line. It doesn't happen often when you're the CEO and you have a lot of staff answering phones. But I have received many calls to my direct line, and I talk to these people. I don't try to pass them off to somebody else. And I'm hearing things like, well, it's me and my wife, and we've been to the Salvation Army, we've been to our church, we've been to the food pantries, and there's just nowhere else to go. And our rent's coming due. And it just, sometimes I'm almost in tears. And I just have to say, I wish I could do more. And as one gentleman said, well, you could adopt me and my wife. And it just really, it really hurt. And that's just one example of the painful conversations that we've had. And everybody in my office has had those conversations. We did eventually get access to the Connect system for some of my staff, and they were able to help individuals reset their PIN into the system. The system would not let an individual, a claimant, reset their personal identification number so that they could access their account. So we worked through that struggle, and then we were able to help a little bit so that they could actually get into the system and manage their claims. But then the system was still so overwhelmed that many people spent hours on the phone trying to talk with someone at a call center. So as I said, that's improving. But even today, I've seen more emails from people like a single mom lost her job and she has nowhere to go. We're seeing people who have been more or less furloughed because schools are closed, because childcare centers are closed, because restaurants are closed, all kinds of businesses are closed. Even the healthcare industry has had to close offices and people have had to be furloughed. And we're happy to see a lot of them being recalled now, such as dentist offices are beginning to take appointments. They're changing processes, of course, and they're not seeing patients as close together as they normally would, but they are at least opening back up and people are getting back to work. So it runs the gamut of emotions. I get calls from people who say, well, I've gone back to work. What do I need to do now? And all of the information is on the website, the Connect website through Department of Economic Opportunity. But it's so easy for them to call, and we don't mind answering their questions as long as we have an answer. So we're beginning to have people call and say, I don't need this anymore, so what do I do? Well, that's a really happy answer to give. So it's nice to be able to see some of that. And I'm really happy to hear Todd's survey results indicating that our area is resilient. And many of these businesses will open back up. So we're ready for that. And we're getting calls from individuals who have lost their jobs and they're thinking about retooling themselves and going to school, learning a new career. So that's kind of exciting too, because that's some of what we do, investing the funds that we have in training people for good jobs.
And Jeff, one of the things that Sheryl touched on that's going to be important, especially during these summer months, is childcare. As workers go back to work or they find new jobs, we've been in this virtual school environment for the past 2 months. Now we're going into the summer months where there will be some programming. I know the city and the county are both working on some programming, but there's going to be issues with childcare that will need to be addressed to make sure that, once these workers go back to work, that their children have something productive to do during the day, and that that it's a good situation for the worker and the children.
Dr. Harper, what sort of long-term scars is this going to leave on our economy?
This is serious business. We're a $21 trillion economy in the United States. Estimates are that between the decrease in the first quarter, actually, we saw negative GDP growth for the first quarter of 2020 relative to the last quarter of 2019. And then we saw a steeper fall for the second quarter, obviously, because so many things have been shut down. Well, it's clear that we'll start to climb out of that trough once July comes around. Business activity is already a bit on the uptick, as Todd noted. And so, the economy is walking down the street, fell into an open manhole, and now it's got to climb its way out. And so that process of climbing out, when we have a good year in the U.S. economy, a really good year, we create about 3 million net new jobs. And so when you consider that we've probably lost almost 30 million jobs in the U.S., 26 to 30 million jobs, more than likely. Even if we have good, healthy growth for the rest of the year as businesses reopen, we're still going to be climbing out of that trough for some time to come. What the Congressional Budget Office is predicting is that the U.S. at the end of 2021 will still have 18, 19 months from now, is still going to have 10% unemployment, and that the rate of production of gross domestic product is still going to be 6% below where it was in the fourth quarter of 2019. So this is serious business, trying to get the economy cranked back up again, and it's going to take time. I expect the recovery to look more like the recovery from the Great Recession, which took, we exited the recession in June of 2009, and people still said it felt weak, felt like we're in a recession 7-8 years later. So that's what I expect to see.
And a lot of confidence had been lost. Do you think that that's going to continue to be the case moving forward with this?
That's the risk. What we're going to see increasingly is that people of a certain age, and we know who we are going to be more cautious about going to the airport to get on a flight and breathing that same air. We're going to be more cautious about going to a big gathering, whether it's the symphony or whether it's going out to eat. And so people are going to start self-segregating more as the economy opens, and those who feel comfortable with that, with the risk of the virus, are going to get back to work and are going to be going flat out. But so much of the spending in Florida, our median age in Florida is 10 years greater than the rest of the nation, and so that means there's a lot of people here who are going to feel cautious until we come up with the medical cure, an effective treatment, and an effective vaccine. That's when we can talk about getting back to 100% economy. Until then, I fear that we're going to be talking about a 90% economy.
And I get all three of you to kind of chime in on this, if you will. What about the fear that business people may have moving forward? I mean, if you think about it, if you maybe got out of college back in 06, 07, somewhere in that ballpark, all of a sudden you're hit with the Great Recession, you have a bit of a recovery, or we have a very nice recovery, quite frankly, and then we're hit with this. How skeptical are entrepreneurs going to be moving forward? And Todd, that may be one for you to tee up initially.
So this is a situation like we've never dealt with before. So, we're kind of writing the playbook as we go along. Fortunately, again, talking to a number of business owners and here in the community, a lot of businesses were able to stay open, even, scaling back 90% of their workforce in some cases, but they stayed open and they made it work. They've been creative. They've done what they've had to do to keep their doors open, or maybe they closed temporarily. There were restaurants that I'm aware of that did that. They said, we're just going to close and, see how long this takes. Hopefully it's not a permanent close, but I'm aware of some that have come back in the last few weeks as the phase one reopening has happened. And so, what does entrepreneurship look like? How do new businesses come online? I really think we're just in a new environment where it's hard to know. Fortunately, we do have a strong entrepreneurial spirit here locally, and there are a number of organizations that are encouraging that and nurturing that. So I think those organizations will be helpful and very important as we move through this. But it's really, uncharted territory and, something, like I said, that we've never seen before.
Dr. Harper, kind of the way we do business is likely going to change. I think technology was starting to sort of move things in a particular direction anyway, but that's something that may have taken, 4 or 5, maybe a decade, years. And it looks like all of a sudden that is going to speed up rapidly.
The retail apocalypse, as you sometimes hear it called, has been sped up. I've never seen an estimate less than 5 years. I haven't seen an estimate greater than 10 years. So I think that we're going to see more storefront businesses, more Main Street businesses close and not be able to reopen. Who's hiring 200,000 new workers, of course, is Amazon. And they're the ones whose stock is up 40% since the beginning of the year. And so it's a different way of going about our business. People who have never shopped online are doing it now. So yes, things are going to be different, but as Todd says, entrepreneurs are going to adjust. They're going to spot the business opportunities where they are, what the customer wants, and they're going to make sure to do it. But it's clear that we're going to exit this recession with more concentration, fewer bigger businesses than we had when we went into it, unfortunately.
One of the areas hit hardest has been the travel industry, tourism, and also aviation. And I want to talk about that when we come back, and particularly how our region had really started making a push towards aviation and aerospace and creating more and more jobs. We're having a conversation about COVID-19, the coronavirus, and how it may or how it has affected the economy within our region, and what may be the story in the coming months, and for that matter, years ahead. We're talking with Dr. Rick Harper, who is an economist, also Todd Thompson, who is with the Greater Pensacola Area Chamber of Commerce, and Sheryl Rehberg with CareerSource Escarosa. Back in just a couple of moments. This is inStudio on WSRE Television, PBS for the Gulf Coast. This is In Studio on WSRE Television, PBS for the Gulf Coast. We are talking about COVID-19 and the effects on our regional economy. As we went to break, I mentioned the fact that Northwest Florida in recent years has made a big push towards aerospace. Well, it's no secret that obviously aviation, travel industry, et cetera, has been affected greatly by the coronavirus. Dr. Harper, how do you think that's going to affect our move in that direction?
I do not think we will experience any long-term detriment in our move towards aviation. We're lucky that the occupant of the new hangars at Pensacola Airport, a city-owned asset that's achieved grant funding to build those hangars, is heavily invested in maintenance, repair, overhaul of the cargo fleet. And cargo business is through the roof. And so they're seeing planes flying more hours. They're seeing those UPS planes pulling up to the hangars, needing their maintenance more frequently than before. Now, admittedly, the company, ST Engineering, has a lot of participation as well in the passenger aircraft market, not so much in Pensacola. So that's shielded the Pensacola workforce. The hiring plans are going ahead for that company, lots of good jobs. And in fact, Triumph Gulf Coast, where I'm the economic advisor, has made a number of awards in recent meetings, recent months, to technical schools, technical colleges that are offering airframe and power plant training to meet the labor market needs. And right next door in Santa Rosa, we saw that actually Boeing just won out over the Airbus challenge in the helicopter business. And so Leonardo is going to be able to operate at their very innovative facility with through-the-gate access to Whiting Field. And so we need trained airframe power plant technicians there as well. So it's going to be a growing industry. The growth forecasts, that's what happens when countries move into the middle class, is people start traveling by air. So that's long-term demand. And wonderfully for our region, it gives us entree into a high growth component of the global marketplace. So it's just a bump in the road.
What about our neighbors in Mobile with the Airbus facility?
Well, they're also upping their desired production levels, and the market for commercial jet aircraft is there's a substantial backlog. We're talking billions of dollars of backlog, thousands of commercial jet aircraft in backlog. So the demand is there. It's true that orders have slowed down in recent months, and airlines are waiting to see. They're trying to get through it, just as other businesses are. But over the medium and longer term, they're going to find the solutions. Again, once we find the health answers in terms of effective treatments, effective vaccines, then everything else will fall into place. It's a health crisis that required us to put the economy in a deep freeze.
Sheryl, what type of opportunities are you seeing with CareerSource Escarosa? What type of opportunities are you seeing for people in our community?
Training. We align the programs that we support training in with Florida West and Santa Rosa Economic Development Council, with the industries that they are working to recruit into the community, and with the companies who need that specialized training. We work with our technical colleges and the school districts to feed students into training programs. And Dr. Harper mentioned and talked about ST Engineering. So ST Engineering is a wonderful partner with the Escambia School District in training individuals in that industry, in the aerospace occupations. And so that's what we're seeing, is those opportunities for people to get into the good jobs with the certifications that are needed by the companies to keep their businesses growing. And we have not seen in the manufacturing industry in general, we have not seen a tremendous loss of jobs in those industries. that's not what we've heard and what's been reported to us. The major loss of jobs have been in the hospitality, tourism, food industry, and some in healthcare. Childcare centers closing down. And there's been some real concentrated effort on that. And I wanted to follow up on what Todd said about the childcare needs. Many of those childcare centers have opened back up. Many of them opened back up in response to the needs of first responders and healthcare workers to make sure they had childcare available. So I've seen a real coming together of the community to respond, and just a tremendous outpouring of understanding and responding to needs. But I'm looking forward very much to the training opportunities that are going to open up for us to help some of these individuals get into a new career. And that's what we're all about, helping somebody be ready to get into that new career and move up into the middle class, as Dr. Harper mentioned.
Right. Todd, from the Chamber's perspective, what are you seeing?
One of the things, and this goes a little bit with aerospace, and that 40% of our economy in the two-county region is military. So that's one of the things that's kind of helped during this period, is that with so much of our economy being driven by that federal spending, over $8 billion a year in the two-county region, that's helped stabilize. I think you're going to see some unemployment numbers coming out tomorrow, where if you look at Escambia County compared to some other counties across the state, the number has spiked, but it's not as bad as a lot of other counties in Florida, because we do have a strong base of a little bit of a pun there, but with our military. That being said, Sheryl's absolutely right. The impacts we're seeing are in tourism and hospitality. Those folks that were either laid off or furloughed, and as that comes back, some of those will be hired, but we're at restaurants, we're only at 50% capacity right now. There will be trepidation in going to hotels and vacation rentals by some people, so that will impact. So that while those jobs will be coming back steadily, it won't be, I don't think, the immediate spike that we would hope to see. So again, between the military and the professional businesses that we have here that largely were able to keep their payrolls going, that's been a positive for us, and so we haven't seen, the numbers that a lot of the rest of the state has seen in terms of the unemployment rate.
Dr. Harper, I'm sorry, Sheryl, were you going to say something?
I was going to add that we are beginning to see jobs come online again. A few weeks ago, the jobs that would come online overnight would be 3, 4, 5, and the last 2 or 3 days, I'm seeing 15, sometimes 20 jobs come online. So I think Todd's right that those jobs are beginning to come back. Many of them, as of today, today's list of new jobs coming online were largely in the healthcare industry. So that's encouraging. It's very encouraging. That we are seeing jobs come back online. People are beginning to hire.
This event really spread across a lot of economic sectors and a lot of industries. You think about what happened with folks in the restaurant business, hospitality, aviation, et cetera, but you also think about what was happening in the medical industry, and I mean those jobs are considered pretty safe, I think, in most cases. But all of a sudden, if you are in some sort of medical field where it's not necessary or it's not an emergency, you weren't allowed to do your thing, so to speak, for a long time. What kind of effect do you think that? I mean, because we do have a large presence in this community as far as the medical community is concerned. What kind of effect is that going to have on our economy?
Well, it's going to have, it already has had a major negative effect. We're really disproportionately blessed in terms of hospital capacity. We have more employees in healthcare actually here in Escambia County for our size than most counties across the nation. And because of elective procedures getting postponed, and scarily enough, even some procedures that would normally cause people to go to the hospital, people haven't been going because they say that's where all the sick people are.
Right.
And so that's a risk. Billions of dollars in revenue have been lost by our healthcare providers. And so over the next number of months, we have to expect that the follow-on fiscal relief acts that go through Congress are going to address healthcare. We didn't expect that at the beginning of the crisis because, after all, it was a healthcare crisis. But what you say is absolutely correct. Leisure and hospitality and healthcare, I think, are among the most heavily hit sectors.
Yeah, and Jeff, just to follow on that real quick, the messaging that's come from our hospitals and healthcare providers this week to us at the Chamber has been, please, if you have an issue, if you have something that needs to be taken care of, it's safe. Go see your doctor. Go to the hospital. If you need to have a surgery done, it's fine. They're very concerned that people are going to put off medical procedures or situations that need to be dealt with now, and it's and there'll be negative effects down the road for those people. So, one of the key messages we want to get out: if you do need to see a doctor, if you do need to have something done medically, do that. Don't be afraid. They have all the protocols in place, and it is safe.
Sheryl, you mentioned there were more and more medical jobs coming online. What types of medical jobs are you seeing?
It's all of them. Lots of nurses, physical therapy assistants, respiratory therapists, phlebotomists. It's all across the medical spectrum.
What kind of effect do you think our universities and colleges are going to experience because of this?
I think it's going to be a major negative impact, because when you look at the source of funding for most of the students here, private colleges are getting hit because they're typically more expensive. They have to cover all the tuition. The tuition has to cover all their expenses, so they're being hit hard. And then the pressure on the state budget is going to be enormous in the coming months and actually on out a couple of years. So I expect to see pressure on college and university budgets, as well as on school districts, K through 12. So we're going to have the position, the unfortunate position, where people need to retool for new sorts of jobs, but it's becoming harder, less affordable, because colleges and universities are going to have to raise tuition to make up the deficit to keep their doors open. So double whammy.
And what about the challenges for municipalities? I mean, you think about, the various, obviously with sales being down and unemployment at such a high rate, people aren't spending like they typically would. So obviously we aren't getting the tax revenue. What sort of challenges is that going to pose moving forward? And let me just throw this in, because Dr. Harper, you mentioned most states have to balance their budget. They're not like the federal government. So where does that leave us?
Right. Federal government's on track to borrow $48,000 this year for every family of four in the United States. That's this year. And so the state of Florida, its biggest source of revenue is the sales and use tax. And so we have about $33 billion a year. We can expect that to fall substantially because it's a strategy. It's a time-honored strategy to tax our tourists on everything that they buy while they're here. So the state will be particularly affected. Municipalities, not so much. Their major revenue source is the property tax. And so we haven't seen home values decline, actually. We've seen home sales fall because people don't want to go out and look at new homes or existing homes, but prices have held up fairly well, and we can hope that those valuations will persist. But, when you put the economy in the deep freeze for a substantial period of time, you cannot go back and replay Q2 of 2020. that opportunity to earn income is gone forever for most of those leisure and hospitality businesses that lost it. And so healthcare as well, it's a service. We can't go back and manufacture extra vacations to Pensacola. So challenge long-term, definitely.
Yeah, and Jeff, part of the answer for the state budget will come through the CARES Act. There will be billions of dollars that come to the state. Now, they don't know exactly how they'll be able to spend that money yet. They're waiting for guidance, but that will at least help plug some holes in the state budget. And we'll see exactly how much money that is and if they're given flexibility to do the things that they would like to do. One thing that we did miss out in the CARES Act was for both Escambia and Santa Rosa counties, there was a provision that if you have a municipality of a population of more than 500,000, you would get funding. So, Escambia is about 320,000, Santa Rosa's about 180, 190. So we're not, if we were an MSA, we'd be okay. But so hopefully there's discussion of another round of legislation coming out of Washington that might provide some potential for some federal funding to come directly to our communities, but we just don't know at this point.
Congress seems a whole lot more open to try to help out everyone in this environment, more so than what happened in 08-09, because nobody's really being blamed for this. I mean, is that a fair assumption? I mean, in the past, everybody was blamed. They got themselves in this, it's the Wall Street banks or the over-aggressive investor or somebody that shouldn't have bought a house or whatever the case may be. Not the case here. So DC seems to be a whole lot more open to helping out. Wouldn't you agree?
They have been thus far, but I'm certainly sensing a wave of fiscal austerity, pressure towards getting the budget deficit lower. That would be, at this point in time, a big mistake, because if you shut down the ability of students to get an education, of states to hire first responders, et cetera, then that perpetuates the downward spiral. So borrow today, pay back tomorrow. There is a time for fiscal rectitude, but it's not right at this moment.
You are watching inStudio on WSRE television. We are talking about the coronavirus and the effects on our regional economy. We'll continue our conversation in just a couple of moments. Please stay with us. You're watching inStudio on WSRE television, PBS for the Gulf Coast. We're talking about the economic impacts of the coronavirus and how our region, Northwest Florida, South Alabama, how we're dealing with it. We mentioned earlier, Dr. Harper, you spoke a little bit about the real estate market and that we really have not seen as much downward pressure on that as one might expect. What do you think's holding it up?
Well, the prices are being held up by a lack of supply in the marketplace. We saw new home starts just came out for April, and they were down, if I recall correctly, 17% relative to a year ago. So compared to the Great Recession, which was kicked off by a glut of construction and oversupply, we just don't have that oversupply right now of either new homes or existing homes. So what we're going to have through time as a result of the way the economy recovers is there may be some downward price pressure on office space, on retail space, but for the moment, at least, the residential sector looks pretty healthy.
Todd, that might be a good question for you. You sure I'm talking to developers and commercial real estate executives and whatnot. What are they telling you?
So it's a great question, and one that I've been working on trying to get some answers, frankly. Most of the folks I talked to said April was fine. They got through April in good shape, but they wanted to see what happens in May. And so I think we'll know a little bit more in a few weeks once we get through the month and see, were tenants paying, are they just going to be behind for a few months, or are businesses going to shut down and be, we'll end up with a lot of inventory. But it's a great question. I don't know if Dr. Harper's heard anything different, but from the calls I've made and the people I've talked to, that's what I've been able to glean so far.
Rick, you want to add to that? Or?
Well, absolutely. The construction sector is still blowing and going, and people are very busy. They've had to adjust their work schedules because you can't have so many different contractors, subcontractors in the same building at the same time. So there have been some pressures like that. There have been some shortages in the construction sector. If you think of things that require a lot of manufacturing and even handwork, such as window casings or doors, those may be in short supply, things that come in from overseas, for example. So yes, some shortages there, but people are still busy working on the jobs that they had a couple of months ago, because we're still only several months into this. But as Todd correctly notes, I think the real test is going to be in the next several months as they look at their book of business for the remainder of the year.
What about the potential paradigm shift? I mean, certainly in the retail industry, we talked about that earlier, but also maybe in office space, because do you think a lot of companies are going to say, wow, this working from home worked out pretty well. So maybe I'll, keep my accounting team or my compliance team or whatever at home. I don't necessarily need them in the office. I don't need to pay for that extra square footage. What are your thoughts on that?
I think that's absolutely correct. It's dawning on business owners, even of large businesses, that they're not seeing any drops in worker productivity that they had feared they would see. And lo and behold, if we can get these workers to actually pay for their own office and instead of us having to rent it for them, so much the better. So I'd expect to see downward pressure in the office rental market in terms of prices and in terms of there will be plenty of space available, I think, as businesses downsize their office presence.
Todd, you want to add to that?
No, I would agree completely. That's exactly what we've seen. I think there was a fear, as the technology grew and the option was there for businesses to do this, but I believe there was a fear of control and, would there be the productivity if you let people work from home? And the feedback that I've been getting, and frankly, that our chamber staff, we've been working remotely for the last month and a half, 2 months. It's, we probably are even more effective now. So I absolutely agree. I think you're going to see more of this. I think it's going to be a permanent change in how business is done. And so, it will have an impact on office space.
Let me kind of go around the table here, or around the Brady Bunch square, if you will, as we sit here and watch this on Zoom. And I'm dating myself, mentioning the Brady Bunch, obviously. But let me get each one of you to maybe give me something that will be something optimistic that will come out of this. This has not been a fun experience for most people, for sure. No question about it. There's been a lot of heartache, a lot of pain, financially, physically, mentally, etc. But what do you see that may be a shining light that will come out of this for the good? And I'll begin with you, Sheryl.
I think one of the things, Jeff, is that we have an opportunity to reinvent how we do business. Even in the social services and education world, one of the things I feel very optimistic about is the use of technology. Our students haven't been to school in a classroom since spring break. we have parents who have become those teachers at home, and they've been sort of nudged and even forced to learn some technology that they didn't know before. And so I think there's a value in these children teaching their parents or their grandparents or their childcare providers or babysitters, so to speak, how to do something. So I believe that there's a renewed emphasis on families doing things together, doing simple things, and really enjoying being together. And that's one of the things I feel. I see it. I see more families, more parents out walking with their children. So I think that's a great thing. One of the things that I am a little concerned about is the slide for students not being able to go to the classroom in that traditional teaching environment. And I fear a little bit that when they do get back to school next fall, and I hope and pray they all do get to back in the classroom, but there may be a little bit of an opportunity to review and help some of them catch back up. But I'm very optimistic about that, though.
Great. And I have about 2 minutes left. So in about 1 minute, Todd, what are your thoughts?
Yeah, just briefly, kind of building what Sheryl said earlier. I mean, again, our community has rallied. 16 years ago, we had a hurricane that devastated our community. 10 years ago, we had an oil spill that devastated our economy. And we've rallied from those two events. We're rallying again. We've worked together and supported each other. And it's always encouraging to see. And again, I think, we've just shown what Escambia County and Santa Rosa County are all about. And we'll continue to work through this together. And I think we'll be better for it.
Dr. Harper?
I'd echo those comments. I think technology is moving us to a better place in terms of healthcare and telemedicine, and also in terms of education, which is pretty expensive in this country. So those are good things. And then also I see opportunities for reshoring. We've realized that some of our supply chains are pretty fragile. And so I would expect to see companies paying more attention to putting those new facilities in the U.S., and we're well positioned in Northwest Florida to take advantage of that and get some big wins on the economic development front.
Very good. Thank you all so very much for spending some time with us. I know things are a little bit different than how we usually do it, and it's been kind of a neat experience here doing it this way. I have to admit, I do miss the studio, but nonetheless, this worked out quite well. So thank you all so very much, and hopefully we can have you guys back maybe a little farther down the road and sort of take a look at the next step and how our region advances. And again, I wish you the very best and take wonderful care of yourselves and stay healthy and safe. So thank you all. Todd Thompson, he is the President and Chief Executive Officer of the Greater Pensacola Chamber of Commerce. Sheryl Rehberg is the CEO of CareerSource Escarosa. And of course, our old friend, Dr. Rick Harper. And I don't mean old as in OLD, but our good friend who's been so kind to be with us many, many times over the years. Always have enjoyed working with Dr. Harper. And of course, he is an economist and well-respected economist all along the Gulf Coast, Northwest Florida, South Alabama. And we certainly always appreciate his input. Also, a very special thanks to all of our crew at WSRE, Mike Rowan and James Roy and Ted King for making this come together. And also my beautiful wife, who knows a whole lot more about the production side of television than I do, and help me be able to pull this off. So thank you to everyone. And we'd also just like to wish all of you the very best. Take wonderful care of yourself. Be safe, be healthy. Thank you for watching. I'm Jeff Weeks. Have a wonderful evening.